series of programs on traditional medicine to talk a bit about the global status of traditional and complementary medicine, especially in the fields of education and research. Include the global definition, a reference from NIH, National Institutes of Health of America. It says that a group of practices and products that are not part of conventional medicine. This is actually the definition of traditional and complementary medicine from the point of view of America. Statistics show that the use of traditional and complementary medicine by the people of the world is increasing, and significant populations of the world use traditional medicine and they use supplements. This choice of the people should be respectable and valuable for us, and in fact for the health policy makers of the countries. And the health policy makers should pay attention to the fact that, considering that the people are choosing, come to identify these medicines and research them. Let those who have sufficient safety and efficacy be included in the health service system of the countries. Practices lacking proven efficacy or safety should be removed. As these practices gain popularity and show effectiveness, governments must pay attention. We cannot ignore traditional and complementary medicine. Society's interest in these medicines is growing for various reasons. Conventional treatment costs are rising, and medication side effects are undeniable. People believe traditional treatments are safer and cheaper. In traditional medicine universities, we emphasize that natural treatments can still have side effects. Despite this, people believe these treatments are safer. We are discussing the reasons for this interest. There are various reasons for society's growing interest in traditional and complementary medicine. Conventional treatment costs are rising, and medication side effects are undeniable. People believe traditional treatments are safer and cheaper, but this belief can be dangerous. Natural treatments can still have side effects. Despite this, people are interested. Often, conventional medicine results are not as expected and can be weak. In WHO documents from 2002 to 2005, traditional and complementary treatments are seen as safer and cheaper, but this belief can be dangerous. Natural treatments can still have side effects. Many still believe these treatments are safer. Increasing interest. Conventional medicine often has weak outcomes. WHO introduced a strategic plan from 2002 to 2005, with a conclusion to be mentioned later. A 10-year program ran from 2014 to 2023, ending this year. WHO is finalizing the 2024 program. Often conventional medicine results are often unexpected with weak outcomes. Additionally, WHO's Essential Medicine and Health Products Department works on traditional and complementary medicine. He introduced a strategic plan to the world, which I will refer to at the end of this strategic plan, and then implemented a 10-year plan in the period from 2004 to 2023, which is actually this year. It's the end. Now Jan Batash organization is preparing and finalizing the 224 program. In fact, it will be 2024, and this program will be announced soon. The World Intellectual Property Organization has published a document that actually advises governments to document their knowledge of traditional and complementary medicine. Therefore, we also need to plan for the intellectual property of Iranian medicine as a valuable heritage of our country. This requires us to work on our Iranian medicine, specifically on the textbooks and documents we have, to update and equip them so that we can utilize its intellectual property. In the White House, a commission has been established called the White House Commission on Complementary and Alternative Medicine Policy. This itself shows that governments at very high levels, even above the government, are paying attention to this issue. So we also need to plan this Iranian medicine as a valuable heritage of our country for its intellectual property. We have to update the documents that we are working on. We need to equip ourselves to utilize its intellectual property and ideas. The White House Commission on Complementary and Alternative Medicine Policy has been established. This shows high-level government attention. The Commission provided a report. The NIH, the largest medical research center, operates under the U.S. Department of Health and Human Services. In 1998, it established the NCCIH, showing high GDP countries are attentive. The National Center for Complementary and Integrative Health has provided a report. Research is being conducted in the field of medicine worldwide. In 1998, it established NCCIH, National Center for Complementary and Integrative Health. Even wealthy countries with high health expenditures do not overlook traditional and complementary medicine. A large U.S. survey shows the use of traditional and complementary medicine by people over a 10-year period, showing 4 in 10 Americans used non-conventional medicine last year. This is very valuable data. Each individual spends several $1,000s, yet they still value traditional and complementary medicine. This data surprised many U.S. health policymakers and sparked debate. Despite high healthcare spending, many Americans turn to non-conventional medicine. This is a significant point. Numerous health policymakers in the U.S. were surprised. The U.S. spends thousands per person annually on healthcare, yet 4 in 10 Americans are turning to non-conventional medicine for their health. Note, 4 of them are using alternative sources. The government is unsure if these practices are safe or effective, so understanding them is a priority. Proactive education and research are needed. Statistics from 2002, 2007, and 2012 show age group differences. They will earn this one place. The government is unsure if these practices are safe or effective. Statistics show that from 2002 to 2007 and 2012, traditional and complementary medicine use increased among age groups 18-34, 35-64, and 65 plus. In the US, 54.9% use these medicines, with conventional ones for better results. This global trend has led to the term integrative medicine, advocating for using all medical potentials. From the ages of 18 to 34, 35 to 64, and 65 and older, the use of traditional and complementary medicine has gradually increased over these 5-year periods. Unfortunately, we don't have accurate statistics like this in our own country. In the US, among the 40% of people who use traditional and complementary medicine, they were asked why they use these practices. 54% believe combining traditional, complementary, and conventional medicine is more effective. This trend is global, leading to the term integrative medicine, which advocates using all available medical potentials. We should use conventional medicine where it's proven safe and effective, and also incorporate traditional and complementary medicine. Notably, 27.7% of respondents feel conventional medicine hasn't helped their illness, surprising health policymakers. About 30% think conventional medicine hasn't helped, indicating weaknesses in it. In places where we can use conventional medicine, if its safety and effectiveness have been proven, we should also utilize traditional and complementary medicine. If you pay attention to this statistic, 27.7% of those who responded said they believe that conventional medicine hasn't helped their illness at all. For a health policymaker spending several $1,000s per person, it's surprising that about 30% of people believe that conventional medicine hasn't helped them at all. This indicates that there are indeed weaknesses in conventional medicine. While we fully respect the services that conventional medicine has provided to humanity over the centuries, it's important to acknowledge these gaps. People were dying from infectious diseases, and conventional medicine controlled these diseases. During COVID, science and knowledge overcame it, and vaccines saved people. We have no doubt about conventional medicine's importance. However, healthcare can be complemented with traditional and complementary medicine. About 25.8% were referred to it by conventional specialists. Increasing this number is a success. Training and educating conventional specialists is key. They saved people from the pandemic, affirming conventional medicine's role. Yet healthcare can benefit from traditional and complementary medicine. 0.8% of people are referred to traditional and complementary medicine by conventional medicine specialists. This article emphasizes that if we can increase this column, we have achieved success. To understand where traditional and complementary medicine can be beneficial and how they can integrate these with conventional treatments. This will enhance therapeutic success. There's another study by a woman named Barbara Starfield, and I've included the reference below. It was published in the highly regarded Journal of the American Medical Association. She is a health policymaker, and the title of the article is the U.S. healthcare system the best? In this article, she states that the leading cause of death in America is heart disease, the second is cancer, and the third is iatrogenic causes, with the fourth being cerebrovascular diseases. I want to talk about iatrogenic causes. Iatro is a Greek word meaning physician. Iatrogenic causes refer to conditions that are caused by a physician. Now, it might come to mind that yes, a doctor makes mistakes and provides incorrect treatment, which can lead to death. This is noted as the third leading cause of death in the United States in this article. But this next slide will be noteworthy, as it outlines the types of iatrogenic causes, specifically those that have led to mortality due to medical professionals. The first one to note is non-error adverse reactions, which account for 47.10%. This means that the doctor hasn't made any mistakes. It's just an adverse reaction. This could be a reaction to a medication or a surgical procedure. So please note that half of the third leading cause of death in America is due to adverse effects from medical treatments. Next, hospital-acquired infections account for 35.5%. Other hospital mistakes are at 0.88%, like stepping on an oxygen hose, and unnecessary surgeries account for about 0.53%. Prescription errors are about 3%. Note, correctly prescribed medications and procedures account for 50% of this cause. Errors in prescription account for only 3%. So note that we have this tendency where there is no motivation for death from correctly prescribed medications and procedures, accounting for 50% of the third leading cause of death in America. The organization has 5 recommendations for countries to integrate conventional and complementary medicine into their healthcare systems, including creating guidelines, conducting strategic research, promoting evidence-based use, and encouraging dialogue. It's the third leading cause of death in America. The organization recommends integrating conventional and complementary medicine by creating guidelines, conducting research, and promoting evidence-based use. The U.S. National Center for Complementary and Integrative Health spent $367 million in 2014 reflecting global research trends. Articles show a significant increase in those with keywords related to traditional, complementary, and integrative medicine. This trend is evident in our country, where our publication share grew from 0.1% to 8.6%. Scopus data shows an upward trend, especially after establishing Iranian medicine universities, which have played a crucial role in article publication by our professors. Numerous studies have been conducted worldwide in this area. This concerns our country, with our share growing from 0.1% to 8.6%. Studies worldwide, including in South Africa, Australia, Austria, Germany, and Switzerland, explore adding traditional medicine to curricula. An Australian study found medical students should learn traditional medicine. Iranian medicine universities have effectively published articles in traditional and complementary medicine. Studies globally explore incorporating these fields into curricula. An Australian study emphasized familiarizing medical students with these fields. In the US, many articles exist examining 130 medical schools. So, do we need to incorporate traditional and complementary medicine into our educational curricula or not? A lot of work has been done in various countries, including South Africa, Australia, Austria, Germany, and Switzerland. There's a study conducted in Australia that concludes we definitely need to familiarize our medical students with traditional and complementary medicine, which was determined through interviews. In the United States, you can find a lot of articles on complementary and alternative medicine. They examined 130 medical schools in this study and found that more than half of them, about 51%, include traditional and complementary medicine in their general medical education curriculum for medical students. The main topics of this education include traditional medicine, acupuncture, methods for enhancing spiritual well-being, and herbal medicine. More than half of them, about 51%, include traditional and complementary medicine in their general medical education curriculum. The UK Parliament has published a report in the field of science and technology. You can find this report on the website parliament.uk. In one of its chapters, specifically the 6th chapter, it focuses exclusively on traditional and complementary medicine, providing an overview for the UK's science and technology system. The article makes 2 key recommendations. First, medical students should be ready to assist patients interested in traditional and complementary medicine. Second, medical schools should include these fields in their curriculum to ensure students know all patient options. And this is exactly what I mentioned earlier. When a patient is using these treatments, it's essential for our doctors and specialists to be familiar with the indications and contraindications of these therapies. The second recommendation states that we advise all medical schools to ensure that all medical students in their general curriculum become sufficiently familiar with traditional and complementary medicine so that they have a level of awareness regarding all of the patient's choices. This article discusses a curriculum developed by a consortium of 27 major universities in the US, which outlines the core competencies in integrative medicine for medical school curricula. This is a valuable model that we can also adapt and use in our own country. Well, there are challenges in our country. Our medical graduates lack familiarity with traditional and complementary medicine. A few units on traditional medicine were added, but it seems insufficient. No research centers produce documentation, and necessary standards for education, research, treatment, and traditional products lack attention. Despite positive developments and good university work, we remain far from defined policies and goals. More support and coordination are needed. Despite recent progress and universities' efforts, we are far from goals, needing more support. On the other hand, there isn't a serious fight against violations and inappropriate interventions. Sometimes we in universities are blamed for traditional medicine due to events happening outside the university under the name of traditional medicine, which we do not accept. We believe that traditional medicine must be scientific and practiced within universities. There are also charlatans, just as there are many in conventional medicine. There are many institutions and decision-making authorities in this regard in the country. There are many challenges in Hosari Pajohesh.